So now moving away from cognitive issues, we also have psychological issues that come up, right? And these are things that everybody has to deal with. So I was sitting outside and I was kind of listening to the group for a little bit, and there was a few things that kind of came up in terms of maybe getting stuck in certain mindsets, or even maybe, I think the example was somebody was getting lost when they drove, right? Somebody was talking about that. I think that's what I heard. And they couldn't read, they couldn't memorize the names of the streets and things like that, or they were getting confused. That's a very common example, right? But the thing that I picked up on was, I think whoever it was said, I felt stupid. Like, how could I not remember these streets, right? So the key thing there, when we're talking about psychological processes, is that mindset that it's so easy to quickly say, how can I be so stupid, right? So when you think like that, what kind of feelings or emotions come up?
Negative. Very negative
emotions, right?
Real quick, excuse me, because on that note, by all means, prove me wrong, but to me it seems like a human's mindset, brain injury or not, it is a negative. Like, for whatever reason, we sway to the negative side more so than the positive.
So you're right. And that's why therapy exists, not just for brain injury, but for anybody.
The average, right.
Right? So that's why there's issues with depression, with anxiety, right? Even with when people don't have brain injuries, people are constantly dealing with that.
Right.
Because our minds sometimes do tend to focus on the negative, right? And in some cases, it's a very common occurrence with brain injuries, because here you are, you came from a very functional, position in your life, and then you had something traumatic happen to you, and now all of a sudden your world is upside down. You have to adapt. Adaptation sometimes can take years. Sometimes you struggle through. You have constant reminders of failure many times, and that's really difficult. So how do you separate yourself from that negative mindset, to take this one example of a failure and not apply it to everything else you've done? And that's very difficult. But that's where a lot of these psychological treatments come in. So we have cognitive behavioral therapy is a very common treatment style that we use for brain injury. And it's one that evidence shows that it creates a lot of benefit for patients.
I'm sorry, what kind of therapy?
Cognitive behavioral therapy. It's often called CBT. Okay? And so this type of therapy really tends to focus on the here and now. So they don't really kind of dive into your childhood or things like that. Sometimes they do, but it's a type of therapy that really focuses on how you're doing right now. And it really looks at how you tend to evaluate your world. Sometimes with the brain injury, you can get really stuck or fixated on certain things. So you can take an example of getting lost while driving, and then you can say, look at that. I'm stupid. I can't even do that. I used to do that all the time, and now I can't. And now the danger of that is you apply that to other things in your life, and you can create a very depressive situation for yourself. Go ahead.
A perfect example. Me and my buddy went to ZZ Top at the House of Blues in Anaheim. And on the way home, we got off the 5 freeway, we went the wrong way.
Okay.
And he's not head injured, there's nothing wrong with him, he's not drunk. He's not head injured, we went like 10 miles down the 12 hours the wrong way.
Yeah.
Dude, we're going the wrong way. He goes, we are? He didn't even know. And he doesn't even have a brain injury. I don't know
right.
Brain injury.
We all make mistakes, right? We all have.
Human.
We make mistakes, we make errors, we forget things, all of us do, right?
Yeah, and I guess sort of on that, we can get this attention bias to things that are negative. At least what we're trying to do here at this group is, since we can do that on the negative end, well, we can also do that same thing for the positive end.
Positive end.
Yeah. That's one great thing to do.
Right.